I came to Dr. Rimmer about 7 years ago with a history of ovarian cancer and uterine cancer, and I've had multiple masses that had to be removed, and they were all benign. Dr. Rimmer was very patient with me and helped me map out a course that was gave me the confidence to go ahead and do it. I cannot even tell you how just completely grateful I am for the time that the entire office and the staff gave me in educating me and helping me make a decision that gave me almost a worry-free life, and it really gave me my life back. Dr. Rimmer and his staff, they're a world apart from any experience I've ever had with medical professionals. I did a couple of things. When I research doctors, I generally look up their medical background, their education, their experience, what they've published. I talk to other doctors in the area, and then I seek out people who have had experiences with the doctor or similar doctors. All indications, everything that I did pointed to Dr. Rimmer. I connected immediately with Dr. Rimmer. I saw he was interested in me, in all of me, my whole history and what's going on in my life. I had cancer on my mind all the time, and he took that worry away so that I'm able to breathe and live a life with having it be an experience I went through, and I'm now able to move on without thinking about it and having it be a part of my nighttime nightmares and my daytime fears. I've always been a healthy eater, and I've always been an exerciser, and now you might say that I'm even more so. It's still hard to, let's say, eat all organic. It's just very expensive. It's not always easy to be in a situation where you could eat organic. I do the best I can. I just eat healthy. I make sure I do weight training and aerobic exercises, but it's just life. It doesn't always work out that you can do it, but I do try to maximize everything I do now and enjoy every day. Number one, be aware of their body. Make sure when everything is fine how it feels, and if it feels different, pay attention to it. That's what happened to me when I detected ovarian cancer. I felt different. I felt an urge to having to urinate all the time, and I immediately went to the doctor, and they detected a tumor, the ovarian cancer. The same thing with my breasts. Anytime I felt a mass, I immediately went to the doctor. I didn't ignore it. I didn't wait. I immediately went. I wasn't afraid of going. I was afraid of not going. I went to a doctor I was comfortable with and I trusted. That was very important to me. I'm sure most doctors do the right thing for their patients, but I do feel that I need to connect with my doctor. I need to have confidence that he's the right doctor for me, and I think that's important. So know your body, make sure you're comfortable with the doctor, pay attention, don't put it off. I've actually mentored some patients that were on the bubble like I was, and took them through surgery and post-surgery one-on-one, and I found that to be extremely helpful to the person that I was working with, as well as I was so happy I was able to give. If you're concerned that either you have a family history of breast cancer or ovarian cancer, that the worst thing you could do is be afraid to get tested or to get clinically diagnosed. I think that there's power in knowledge, and there's power in seeking out other women that have gone through it to help get confidence in your own decisions. So I would encourage any woman that's concerned, either if they don't have it, like I did not have breast cancer before I came to Dr. Rimmer, I had other history. I would encourage any woman to seek out any concern they have and get ahead of it. It's certainly better in the long run if you get ahead of the issue, both mentally and your physical outcome.